Hey, welcome to the Nursing Dose with Farah. Today I'm going to be talking about how to get hired faster and with confidence, and basically my new course called New Nurse to Dream Role, and really talking about how not to settle as a new nurse. All right. So right now I am live on TikTok. What's up, TikTok, YouTube, LinkedIn, Facebook, and Instagram. So what's up to everybody watching? If you're just joining or watching the replay, just wanted to say thank you for watching the replay. And if you don't know me, my name is Farah Dr. Laurent. I've been featured on the Jennifer Hudson Show, Black Enterprise platform, multiple podcasts and other media. And really, my purpose is to really support new nurses getting their ideal positions, making money moves, right? Making business moves and making money moves. What's up, Dee? Just joined TikTok. She just joined my coaching program. So shout out to her. Super excited to be working with her along some others. And if you are watching and you're interested in joining as well, my coaching program, please direct message me. I do have some space in my group coaching program. So let's get into it. Today, I'm going to share 3 tips for all you new nurses on how to get hired faster, right? Into the specialty roles that you want. So hence the title, New Nurse to Dream Role, and why it's important not to settle for less, okay? So I know I've been there. I was a new nurse, a nursing student, and my clinical instructor told me that I would never be an emergency nurse, and she told me that I should stick to med-surg, even though I didn't want to work med-surg, and literally laughed in my face and said I'd never be an ER nurse. So fast forward, of course, I didn't listen to her, became an emergency nurse right out of nursing school, got hired before I even passed my boards. And, in my head, I was like, all right, cool, watch me, So this is what I want to do for the new generation of nurses, is to infuse that same type of boldness, that same type of confidence, because you can do what it is that you want to do. And who wants to go to nursing school for 4 years or whatever it is, how many years you're going to nursing school for? Work that hard, right? Like I always say, blood, sweat, tears, and a whole lot of tears to just settle for anything. You don't want to do that, right? You want to make an impact and work with the population that you really want to work with. And you want to be able to make money moves, right? So thank you again for watching. We're going to get right into it. Please let me know any questions or comments you may have regarding the job search process as a new nurse, and, interview questions you may have. Drop them in the chat. I'd love to answer any questions that you may have. And if I watch the replay, I can also turn your question basically into another live show. Okay. So let's get into it. Let's get into what are the myths, right? So let me just debunk a couple myths. The main ones are that new nurses have to start in med-surg. Okay. If anybody knows me and knows my content, I strongly, strongly disagree. You do not have to start in med-surg if you don't want to. In fact, you don't even have to start in the hospital setting if you don't want to start in the hospital setting. All right, so that's myth number 1. And then myth number 2 is you need to work in the hospital to acquire certain skills before you get to XYZ, whatever it is you want to do. So a lot of people maybe want to go into community health or, in an outpatient setting or something, but for some reason they're told that they have to start in an acute care hospital setting first before they can go outpatient or before they can go into the community. And again, I don't believe that. As a nurse, you have the skills to work anywhere. My biggest advice is to find the organization, facility, position that fits best for you and then really research the organization before you apply. The biggest thing is make sure that you have a really good orientation onboarding system and ask the questions of like, when will you be on your own? What's the preceptorship look like? Or, the education going to look like wherever you go? And make sure that you're happy with that and that you're going to be supported throughout the way. For a new nurse, I strongly recommend that you have at least an orientation, whatever that looks like, from 3 months to at least 6 months, potentially a year, and try to get into a nurse residency program, specifically if you go to an acute care setting like the hospital. If you're going to go to higher levels of care, acuity care type roles, such as the ICU or the ED, where I started, you definitely need a minimum of at least 3 to 4 months of orientation. Okay. So, I used to be the director of education at a particular hospital. They were only giving their nurses 6 weeks of orientations, and sometimes they're trying to push their nurses off orientation sooner to like 4 or 5 weeks. Okay, that is insane. You should not take any position as a new nurse where they're only offering you 4 or 5 weeks of orientation. Okay. You barely can find your way around a place. It takes at least 2 to 3 weeks to get comfortable with just the environment alone. Okay. So that's number one. My biggest tip is do your research before you apply for any position. Okay. So let's get into my 3 tips. And for anyone just joining, I'm going to be talking about tips on how to get hired faster as a new nurse and with confidence, and how not to settle. Okay. Meaning not to settle just for any position. Don't settle just for the first position. Also, make sure that you negotiate your salary, things like that. Okay. So tip number 1 that I'm going to work to talk to you about and to kind of break down a little bit. The number 1 tip is clarity. Okay. Shout out to everybody coming on TikTok. Again, for those that are just joining, I will be having a free webinar for new nurses October 15th, this Wednesday at 12 noon. Please email me or message me if you're interested. And again, that's 12 Eastern, noon, Wednesday, this October 15th, for new nurses. And again, when I say new nurses, this is brand new nurses or senior nursing students, or any nurse that's particularly less than about a year or less than 2 years. And maybe you hate the current role you're in and you want to make the transition to something else. This webinar is for you. Okay. And then just message me to get the Zoom link to be able to access this free training that I'll be doing October 15th. Okay. And again, you will have the opportunity to join my coaching program if you meet the requirement. And this coaching program, I'll get into it a little bit more, but it'll be basically weekly coaching by me, and it'll be in a group setting. Okay. So let's get into it. Tip number 1. Tip number 1 is have clarity. The reason why a lot of new nurses are not getting hired is because they're not clear on a couple different things. Number 1, they're not clear on what it is that they truly want. And that's okay, right? As a new nurse, you may not know what role that you want to go into. So for example, for me, I knew I wanted to go into the emergency department as a new nurse. I absolutely love that fast-paced environment. I did my last preceptorship in the ED, and that confirmed that the ED was for me. Some people may not know that, right? So through my coaching program, through my course, the New Nurse to Dream Role course, I break down what questions to ask yourself to get clear on what particular area you should be pursuing. Okay, and again, don't listen to other people. Really assess your skills. Really ask yourself the question, where do you see yourself on a daily basis? Is it an acute care facility, fast pace, or do you see yourself in an outpatient community setting? Or, what population do you want to work with? What population brings you joy? Do you like working with just 1 or 2 patients at a time? Or do you like talking to a lot of people in a day? What does that look like for you? Okay, my mic just got disconnected. Okay, and then the other thing is, what location do you want to work in, right? A lot of the new nurses that I work with, they may be going to school in one city, but now they want to explore maybe going back home to work in the city they're from, or maybe they want to leave their home city and go somewhere else, right? So for me, I grew up in Canada, did my bachelor's degree in Canada, did ER there for 5 years, and then I was like, you know what? I'm tired. I want to leave this small city in Canada and I want to move to a big, big city. I want to move to New York City. So I pursued travel nursing after having 5 years of experience in the ED. So again, for anyone who's interested, who's watching this, that wants to be a travel nurse, you absolutely need at least 2 to 3 years. And I recommend typically actually having 5 years before you venture off to be a travel nurse, because you have to be extremely confident and skilled, because you don't get orientation as a travel nurse. You literally get 1 to 2 days and then you're thrown in. So I left Canada and moved to New York City to pursue travel nursing. So for you new nurses, you may want to go to a big city. And it just, one question that comes up a lot is like, what is the pay, right? So national average for most nurses, this is according to, statistics in the US, on average, a new nurse makes about $90,000, give or take, depending on the city you're in. But that's average across the US, an RN, okay? Probably with the BSN, right? However, most of the nurses that I work with, particularly, are in the New York City area, the San Francisco area, and also, Northern California, right? I'm a nurse. Any study advice for the HESI? Girl, just know all the systems, okay? That you just got to study. And the way you study, I would say like concept based, okay? Concept based. So like, know what shock is, know the big things, CHF, chest pain, asthma, okay? Good luck on your HESI, girl. If you want to join, like I said, the group coaching program, you don't have to be a nurse. You can still be a senior nursing student looking for a job and still join my coaching program, or you can join this free webinar that I have coming up October 15th. Just message me if you want to get in. I will send you the Zoom link, or you can email me at FarahLaurent1 at gmail to get the link. Okay, so back to the clarity. Most people don't get their first position because they're not clear on what they want. So once you're clear on what it is you want, the city you want to live in, the hospital system you want to work for, the position, or, the area of nursing that you're really passionate about, what you need to understand is you need to develop your why story. Storytelling is very powerful in the interview process. And this is something I go through with my coaching clients one-on-one and also in the group coaching program. You need to be clear on your why story. Why nursing? Why did you get into nursing? And it has to be a compelling story that someone's going to want to listen to, because when they ask you, tell me about yourself, part of that interview pitch has to include your story, right? Why you got into nursing. Okay. And particularly why you want to get into L&D, why you want to get into the ED, why you want to get into PEDS. They want to hear that, right? They want to know that you really want to be there and belong, not just like applying just to get a job, right? Because they want to make sure that the care you give is very genuine. You're going to connect with this patient population and that you truly genuinely care. And that is what makes a really good nurse, right? That you're like super passionate about the population, what you want to do, and you want to make an impact. So know your story and know how to tell it so that it's compelling during the interview. Okay. Thank you, Tasha. I appreciate it. I got my hair did, right? It's much lighter. Okay. Thank you for noticing. So yeah. So step one is clarity. So you know how a lot of organizations say, they have a mission, vision, statement. you need to kind of have that same thing as well for yourself. Okay. And how you're going to articulate that in the interview, that's what I help you and guide you through on how to say it without rambling on and being very concise and clear. Okay. So, like I said, clarity is step one. We talked about knowing your story, knowing your why, knowing your vision, your purpose, and what impact you want to make in nursing. That's very important in your clarity. Okay. Now let's move on to step two, which is competence. Okay. Shout out to everybody on TikTok. Like I said, if you're just joining, I'm talking about how to get hired faster and with confidence as a new nurse and how not to just settle for less. And I'm talking about my course and framework and coaching program called the New Nurse to Dream Role. I've helped over 200 nurses land their dream job in literally less than 90 days. So if you want to learn more, please message me, direct message me, or email me. I have a free webinar coming up this Wednesday, October 15th at 12 noon. Email me at FarahLaurent1 at Gmail or just direct message me and I'll send you the information. Okay. So the first step is clarity. You need to have clarity in the job search process and in the interview process for you to get hired. Number two is competence. What do I mean by competence? You need to know your stuff, right? Nursing is obviously very clinical. Depending on where you're going to work, you got to know your stuff. Especially if you're going to be in critical care areas, they will 100% ask you clinical style questions. So this is where the competence comes in. And it's one thing to know your stuff. I know someone asked about the HESI exam and all that. It's one thing to know your stuff, but to be able to critically think and apply the information, because they're going to most likely ask you a case study type question, or they're going to ask you a prioritization question like, hey, you have these 5 patients with this, this, and this. Who are you going to see first and why? They want you to know the rationale. They want you to be able to identify signs and symptoms, recognize changes in conditions, recognize medical emergencies, and how to act upon them quickly, right? So you need to be answering in a concise manner that you know what you're talking about, not rambling on all over the place. So just quickly, some things that you definitely need to brush up on, like I talked about, was, chest pain, shortness of breath, sepsis, stroke, those types of things you definitely need to know because they're common things that can happen anywhere, right? And how to handle emergencies, okay? So that's something that I go through in my coaching program in depth. And then the course that I have, New Nurse to Dream Role, I literally go down every system with particular emergencies that can happen. And then I go through, like, say, if you want to be an L&D nurse, mother baby nurse, med surge, ICU, ED, all the things that you should have a really good handle on and how to handle any emergency. We go through that. And that's big on the interview part of the process of my program. Okay. So again, if you want to join the program, I have an opening in my group coaching program. So definitely message me if you want to get in. So not only do you need to know your stuff in terms of like clinically, but you need to be able to articulate them confidently, right? What do I mean by that? So like if someone is short of breath, for example, and you're like, okay, I think we should put a non-rebreather on, and you're answering it like you're asking them a question, they're going to be like, does this person really know what they're talking about, or are they just guessing or making stuff up? So you have to be very sure in your answers and articulate them very clearly and confidently and able to give a rationale about why you're doing what you're doing. So that's what I'm talking about when I say competence, okay? A big thing that I recommend, especially if you're going in an acute care setting or critical care setting, you definitely should get an EKG or ECG course, okay? A lot of my clients, I recommend to get this. It's the AACN ECG course, and it's phenomenal because when you do get the job after working with me as your nurse career coach, you will get an orientation. And on orientation, they will definitely give you an ECG exam. Okay. So, step one is clarity. Step two is competence. And then step three is confidence. You need to have confidence in the whole job search interview process for you to get hired. If you are not confident, I don't care what you have on paper. You could be one of the best candidates on paper, meaning like you have all your certifications, all the stuff. But if you can't demonstrate that you are confident in the way you present yourself, the way you communicate in the interview, you will not be getting the job. And the confidence also stems from your mindset. Do you truly believe that you will get the position? If you don't truly believe that, it's going to show in your interview, it's going to show in the way you communicate, and the interviewers are going to know, right? So that means you might not get the position if you can't show that confidence, right? And this is why a lot of times, like some candidates would be like, I don't understand why I didn't get the position. I mean, there's a lot of different factors, but they're like, oh, I keep getting interviews, but I'm not getting the job. 100%. It's either the way you communicate or your lack of confidence or your lack of belief that you can get the job. Deep down, you may not feel worthy of getting into the ICU, ED, L&D, whatever it is. There's some doubt there, and the interviews can feel it. And when I talk about energy, that's part of that energy that you're exuding. You may not know it, but you're exuding some type of energy. Okay. Energy is extremely important in interviews, right? And I'm not talking about like show up to the interview cocky, right? But you need to be confident. So in order for you to be confident, you need to know your stuff, which is the competence, right? But know your stuff so well that any question they ask, you can answer. And that's the type of confidence that I give my new nurses when they work with me one-on-one or through my coaching program. It's a proven system. The framework that I give them and the strategies they use work. One candidate, Lindsay, you can go on LinkedIn and check out my recommendation section. She wrote me a whole thing, and I think she mentioned it in her testimonial. Out of 2,700 candidates at Kaiser in California, 2,700, she got selected as one of the top 10 candidates and got hired. All right. So when I say my strategies are proven, they are proven. So again, if you want to join my free webinar coming up this Wednesday, October 15th, message me, email me so you can get in and learn more about my coaching program, my strategies, and how to get hired with confidence. Okay. So energy is number one. So that means even your enthusiasm, the way you speak, all that. And then also image. You have to look good when you go to the interview. I don't care if you don't like wearing makeup. If you don't know how to do your makeup, I usually don't. Get it professionally done. Invest in a really good outfit. All my clients know, like I tell them from day one, like you are not going to the interview looking like everybody else. You can't wear the same black suit that you've been carrying around to everything, or the gray suit, or the navy blue. Wear something bold. I talk about the bold new nurse. It's actually one of my newsletters on LinkedIn. The bold nurse and the confident nurse is the one that's going to get hired. So show up looking bold and confident in your outfit. You will make a statement before you even speak, before you even enter the room. They're looking at you and they're paying attention and you're standing out. Okay. So come through with like a really nice color, whether it's like, say, green. I had one client wear all green. She was in a sea of black. She was the only one wearing green. She got an L&D position in California. Okay. So that was her. If you don't like wearing suits, you don't have to wear a suit. You can wear a really nice dress. I had another client of mine, Lauren, loved working with her. She got a job at Loma Linda Critical Care. She wore a blue dress, knee length, and then wore a white blazer. Beautiful. Okay. So literally, I have my clients physically stand out, and in their confidence, their preparation of the interview, they slay the interview because they're so confident and they're so prepared. Okay. Then communication. Again, you need to practice, but not sound like a robot and don't sound scripted. So I do mock interviews with my clients. We go through commonly asked questions and we craft a pitch that does not sound like everybody else's, which includes your story, the storytelling, and all that. And really, how you deliver your pitch is very important, right? The delivery, the enthusiasm, do you believe it, passionate, speaking from the heart, all that stuff, okay? And then what's your vibe in the interview, right? If you're confident, you're prepared, you're going to have a different vibe than someone who's like super anxious, super nervous, doesn't believe they can get the job, very like meek, sitting like not sure what's going on. And you don't want to have an interview where it's like interrogative, like question, answer, question, answer, question, answer. It's just like so unnatural. You want to come in with your personality, your vibe, connect with the interviewer, and make it a conversation. It'll break down the ice, break the barriers down, and they're going to be like, oh, I really see this person on our team because they fit well, they're comfortable. That is that confidence and that prep, okay? And then lastly, that's it, just the confidence, right? And the way you connect with them, like compliment them on something. Psychology, use things like, eye contact, shaking their hands, the way you sit, your posture, all of that is important in the interview, okay? So if you just missed it, I shared 3 tips that'll get you hired in the interview process and the job search process. Number 1 is having clarity in your job search and being strategic on how you're looking for jobs and how you're speaking to hiring managers. And it goes beyond just sending an application and that's it. Number 2 is the competence piece, which is how prepared are you for your interview? Clinical style questions, behavioral style questions. Do you have your interview pitch down? Okay. And not sounding like a robot, but infusing bits of your personality so you don't look and sound like everyone else. That's going to help you stand out. Okay. And then number 3, the confidence piece. How are you communicating? How are you showing up to the interview? Like professionally, looking fabulous, smelling good, all that stuff. Don't show up in scrubs. Please don't show up in scrubs. Oh my gosh. Invest in your outfit. It goes a long way. Do your makeup, all that stuff. There's actually research that says females that wear makeup actually end up making more money when they get hired. So, it's backed by research. Okay. So that's basically it. And again, for those who don't know me, like I said, I'm a nurse career coach. I've been doing this for 4 years. I've helped over 200 nurses land their dream role. If you want to work with me one-on-one, you can direct message me. If you feel like you're okay in a group setting, you can join my group coaching program. I'm currently accepting new nurses, but I cap it after a certain point because I want to make sure that I give full support to the nurses that I'm working with. Yeah, do not wear scrubs. It's not a good look. No. It's going to look like you don't care about the interview. Do not wear scrubs. No. Invest in an outfit, okay? And make sure that it looks good, it's fitted. Don't borrow someone else's suit or someone else's outfit. Pick something that's going to be complementary to you and that you feel confident. Like if you don't typically wear heels, don't show up in heels, like walking all funny to the interview. Like maybe wear a wedge or a flat type shoe that looks professional, right? Business casual, yes, but don't be afraid to wear some color. Don't wear black, gray, or navy blue. Wear something that'll help you stand out. You know, wear makeup, do your hair, all that stuff. You do not want to show up to your interview looking raggedy, as I say. Okay. I missed a bunch of questions, but I'm going to quickly go through them in a few minutes. But if you have any questions, even if you're watching the replay on LinkedIn or YouTube or any of these other platforms, drop any comments or questions that you may have. I'll stay on for a few minutes to answer any questions that you guys have. And like I said, please email me right now if you want to get into the group coaching program. We meet every week. We'll be meeting, I believe, this Thursday. I haven't set the date and time, but I'm pretty sure it'll be Thursday. So Wednesday will be the free webinar training. Message me if you're interested in that. Or if you're like, you know what, I don't even need to go to this webinar. I know Farah brings value. She has all these testimonials. I want to get into this program now. I don't want to wait. Just message me, direct message me, or email me at FarahLaurent1 at Gmail. And again, this is not a free coaching program. I just want to throw that out there. I create content literally every week that's free, and a podcast that's free. YouTube, I have a ton of podcasts that I've been on. So I have a lot of free content that I give away all the time. This is a paid coaching program. So only message me if you're serious about investing in your future and serious about investing in yourself, your professional development. And if you want to get hired faster and with confidence, then message me. If you're not ready, do not message me, please, because I do not want to waste your time or my time, because it's very valuable. Time is the only thing we have. So like I said, my clients get positions in less than 3 months, okay? On average, they get positions within 1 to 2 months, depending on like when the residency programs are open. There's different factors, but if there's an opening and they have an interview, trust and believe they will get that position. A lot of my clients get same day offers. So yeah. So like I said, email me, FarahLaurent1 at Gmail, or direct message me to get into my group coaching. If group coaching is not your thing and you want more one-on-one support, I do have a program for that as well. So super excited to meet you guys. I hope this was helpful. I hope that I was able to give you value. And again, I will stay a few minutes here on TikTok to answer any questions that you guys have. And then I'll watch the replay back and I'll go back and answer any questions that you guys have. I typically go live a couple times a week during the week, typically around lunchtime Eastern, between like 11 and 1 Eastern. So look out for that. Look out for my content that I do. Please share this replay, share the replay with your friends, or tag a new nurse that you think would benefit from this information and from my coaching program as well. All right. Hope you have a wonderful weekend. I may go live tomorrow potentially, but if not, have a great one. And I'll talk to you soon. And I'll see you in the coaching program again, only if you are ready to take action and invest in yourself.